one of the fundamental deficiencies, I would say, in our field, and we have meetings centered on this, is the fact that right now we really measure spleen and symptom reduction as our primary endpoints for clinical trials, because that's what we started the field in with JAK inhibitors, and they're really good at doing that. They don't do it for everyone perfectly, and they don't always maintain it for every patient indefinitely. So that's some of the nuance. But we are moving into an area where we're looking now at therapeutics that are anticlonal, that might be able to change the natural disease history. And the problem with the trials we design often is that we don't follow patients, because you need a lot of patients, you need a lot of power to do it statistically. We don't always follow them to the point where we can confirm survival. So we are in a desperate search for surrogate markers that you can look at earlier on, whether it's spleen reduction or symptom burden even, or bone marrow fibrosis reduction, driver mutation reduction, cytokine reductions, things that you can measure maybe at a 6-month period that may correlate and associate down the line with a survival benefit. So it's really, I think, key for us as investigators, and the Research Foundation brings us together, and patients, to figure out how do we do that as a group so that we're not at the stumbling block where we're trying to understand, like, what are we really achieving?
Yeah, and I think you bring up a really good point about the time that it takes to actually measure that, as well as the amount of maybe data that we need to actually start to measure that and identify what some of those surrogate markers might be to be able to, whether it's measure progression or just overall disease modification. And so we at the foundation are looking at different ways that we can attack that data problem and see can we aggregate more data and understand the clinical markers that patients have experienced over time to be able to build that body of evidence and identify some of these surrogate markers.
And I think the point of we need to work together is so key, because in these rare diseases, if we work in silos, it's not going to be effective to move the field forward. So even things that aren't so simple, but like pooling data, whether it's patient level data, the way that you guys pull it from patients that are providing their data, and that's a generous and ambitious, endeavor, because that becomes very important, because that's real world data. Or if it's taking prospective data from clinical trials, pooling it together so that we have the power to ask these questions. Because right now the trials we do in MF, PV, or ET are relatively small trials. They're not thousands of patients trials. We need to pool data. That means sponsors also need to be, I don't know what the right word is, but to be generous is probably not the right word, but to be
forward-thinking.
Forward-thinking, and and I do think I do see that. I mean, I do see the sponsors that are invested in this area coming together at the table. We have initiatives to try to pool prospective data together to ask these questions, particularly in the setting of JAK inhibitors, which is sort of the first line of therapy. I think what's exciting now is that we are trying to move beyond JAK inhibitors or combinations of JAK inhibitors. We do have, I think it's important to mention, we do have at least one clinical trial, which is a randomized phase 3 trial in the relapse refractory setting that is looking at survival as an endpoint, and that's unique. So imetelstat in the randomized phase 3 study is looking at a survival endpoint. So I applaud Jaron and the team for going after that endpoint. That is important to patients and physicians, obviously. And now there's a whole number of really, I think, active agents that are rational, that have been combined with ruxolitinib or are using after ruxolitinib failure to try to push the envelope and improve outcomes. And we need to be patient, obviously, to see these things through and follow them through.